Hi, my name is Danielle Howard. My informative speech is on hyperthyroidism. Hyperthyroidism is a condition that causes complex issues that is a person's in a person's body. Hyperthyroidism is most common between the ages of 20 through 40, but it occurs anytime. This autoimmune illness causes unintentionally weight loss despite of increased appetite and irregular or increased heart rate as known as tachycardia, which also lead to insomnia, anxiety, and mood swings. If left untreated, hypothyroidism can cause many other delivery illness. For example, it can cause irregular increased heart rate, which can lead to blood clots, stroke, or even heart failure. In most cases, hypothyroidism is a common and life-threatening disease that mainly goes unnoticed. Last year, my aunt was diagnosed with hypothyroidism. Months prior to her diagnosis, she complained about having difficulty with sleeping and her anxiety. She was also complaining about being so hot so often it led her to carrying a battery powered fan with her due to the age she just assumed it was menopausal. But her doctor told her that the older women who experience hypothyroidism, the symptoms can resume menopause. After a few tests, she figured out that she had hypothyroidism. Hypothyroidism is the most common in women. However, it has a family history of thyroid disease. High amount of iodine in your bloodstream or the use of nicotine, it can cause increase of chances of having hypothyroidism. The most common cause is Graves' disease. Graves' disease is an autoimmune disease where the immune system attacks the thyroid gland and causes it to produce too much of thyroxine. An overflow of thyroid hormone can cause the body metabolic process to speed up, which is why it can also make type 1 diabetes difficult to manage. Another cause of hypothyroidism is too high amount of iodine. Iodine is a common food such as seafood and baked potatoes. Since the thyroid gland use iodine to make both thyroid hormones, amount of iodine can cause huge increase of the hormone to be made. According to the U.S. Department of Health and Human Service, in 2021, there were at least three ways to treat hypothyroidism. Those options are medical, radioactive iodine therapy, and thyroid surgery, removal of the thyroid. Beta blockers can help diminish symptoms while a more permanent treatment type is found. However, they will not stop thyroid hormone producing. Specific anti-thyroid medication may slow the production of the thyroid hormones and make some Graves' disease symptoms temporarily pause. However, anti-thyroid medication comes with many side effects that cause the treatment can range from 1 to 2 years and not permanent solution. Another option will be radioactive iodine therapy. Doing this cell of the thyroid gland are slowly destroyed. This process does not affect other organs. Also, people who undergo radioactive iodine therapy have a higher risk of delivering hypothyroidism under acting thyroid glands, but according to the article, it is easily treated and managed. Finally, the last invasive form of treatment is partial removal of the thyroid gland. This can cause thyroid hormone level to settle back down, but because of the anesthesia used, one may experience a temporary worsening of symptoms. In conclusion, hyperthyroidism is a common and life threatening disease. However, it mainly goes unnoticed. Symptoms of this disease can lead to hard menstrual and fertility cycles and can worsen your anxiety. It is important to recognize these symptoms because, if left untreated, hyperthyroidism can cause stroke and insomnia. It is important to remember this condition can be caused by grave disease, iodine rich diets, and nicotine. There are many treatments, each of the various degrees of effectiveness, which must be weighed between you and your physician. However, the first step is active recognizing these symptoms before the condition has chance to worsen. Thank you.